Okay, so today we're going to look at some sample questions for the MRCGP AKT, specifically the two most common formats, extended matching questions and single best answer questions. And we'll just touch on some of the other question formats. So my name is Muhibur Rahman. I'm the Medical Director of eMedica, so thank you for joining us. Let's start by looking at the different question types in the MRCGP AKT. So as I mentioned, the main question formats are EMQs and SPAs. But some of the other question formats that you might see, you might have some questions where they will give you an algorithm, for example, maybe one part of a nice guideline, and ask you what goes in a box that's blanked out. They might actually ask you to drag and drop some labels into the correct places. You may have some picture questions, so they might give you a description of a case, perhaps show you someone who's got a skin lesion or a rash. They might show you a fundoscopy, maybe an inner ear, and ask you what the diagnosis is. Multiple best answer questions. So this is where there's more than one correct answer. You know, which two of the following are risk factors for whatever. You have to get them both right to get the mark. There'll be one or two questions testing specific knowledge of seminal trials, i.e. trials that had a big impact on general practice. You may get a video question, which will give you a short clip, no longer than about 30 seconds, and then ask you a question related to that. Short answer questions. So these are questions that will ask you a question and there are no options to guess from. There'll be a blank space. You have to type in the correct answer. And then rank ordering questions. So they'll give you a question and then they're going to ask you to rank the answer options from best to worst. You've got to get the whole order right to get the 1 mark. Okay, so these are some of the different question formats that you can face in the MRCGP AKT. But what I want to go through is the most common question format. And before I do that, I just want to show you how the screen is laid out and some of the features that you can expect. So the most common question format is a single best answer. And a single best answer question, what you'll see is on the top left hand of the screen, there will be your name. On the top right hand side, there will be which question number you're on and how much time you have remaining. You're usually not allowed to take a watch-in with you into the exam room. There's a symbol here to flag for review if you weren't sure, and a calculator symbol if you want to use an on-screen calculator. And the single best answers, they'll have a question title, there'll be one question and usually 5 options, and you can move back and forward with these buttons at the bottom. So let's actually have a look at an actual single best answer question. And what I'm going to do is I'm going to pop a 57-second timer, because that's how much time you've got, 57 seconds per question, if you want to be able to get through the whole exam and just finish the last question as the buzzer sounds. If you want to have sort of 8-10 minutes to go over questions you're unsure of, you've got about 54 seconds per question. So let's have a look at a question. Here's an example of a single best answer question. Here we go. Okay, so time's up. Let's have a look at the correct answer. So this question was about drug monitoring, and it's an area that people have often struggled with in past AKT exams. So the main areas to look at in terms of the question here was the fact that this patient is being started on a statin. Now with statins, the main things that we look for are changes in the liver. So we can ignore the options here that relate to renal disease. We wouldn't really be concerned about and test for renal function with statins. We would be looking at that, for example, with an ACE inhibitor. So the main thing are to test liver function, because the statins can affect that. And so you'd normally check that at 3 months and then again at 12 months, according to the latest NICE guidelines. And then at 12 months, if they're okay, there's no need to test it again unless the patient presents with some kinds of symptoms that make you think that perhaps their liver is affected. So perhaps, you know, they've come in and they're jaundiced, or they've got you know, sort of itching of the skin, or they're having aches and pains, or something like that. Okay, so that's an example of a single best answer. Now let's look at the other main format, which is the extended matching question. So with extended matching questions, the top part of the screen is exactly the same. You still go back and forward with these buttons at the bottom of the screen. One of the key things is that there is one question per screen. So with extended matching questions, they come in sets of 2, 3, sometimes 4 or more. And so you'll see that on the right hand side of the screen are the answer options. On the left hand side of the screen there's one question, and it says here, for example, 1 of 2. If it was 4 in the set, it would say 1 of 4. When you were to click next, the next question will have exactly the same answer options on the right, so that part doesn't change at all, but it has one question on the left hand side. Okay, and it's actually very different to how most online services and all the books lay out extended matching questions. They tend to put all the questions in a set on the same page, which actually makes it slightly easier than the real exam, because you can say, oh, the second one is B, the third one is C, and you can look back at them on the same page. The way that our online service is laid out is similar to the real exam, that we have one question per screen for EMQs, so that you get used to the real format. That'll speed you up on the day of the exam. And if you're going to get any surprises, it should be that the exam is a bit easier than what you're expected. You don't want to practice with something that's actually easier than the real thing and then get a shock on the day of the exam. So anyway, let's have a look at a set of EMQ questions. We're going to keep it simple so that this video doesn't become too long for you. We'll do 2 in a row, okay, 57 seconds for each one. Here we go with the first one. Okay, so time's up. Hopefully you've put down your answer for both of those questions. Let's go back and look at the first one. So the key features with this one is he's a 68-year-old man. He's got sudden loss of vision in one eye. It's not painful. His vision is reduced to counting fingers only, and the other eye's fine. Okay. The key features on examination is that he's got a pale retina and a prominent fovea. Now this could lend itself quite well to a picture question. So I might actually show you a picture that might look like this, or they might actually just give you a description like this. So another description sometimes you might see, instead of a prominent fovea, they might describe a cherry red spot. So the correct answer here is B. This is a central retinal artery occlusion. Let's move on to the second question. So here, the key features are that, again, it's an elderly gentleman, he's 70 years old, he's got gradual loss of vision. So that's one of the big differences from the first question and this one. This is gradual. Started off with a mild blurred vision, but it's got worse over a period of days, so 3 days. And he's also got some of the classical features of this condition, that he's got some dark spots and lines in his vision. And this vision is also reduced to the same amount, counting fingers only. The other eye is not affected, okay? If we look at the risk factors that are mentioned, that they've given you in the question, that this patient is on treatment for hypertension and is diabetic. So these are 2 of the risk factors. So sometimes there's clues like that in the history that you can watch out for. And in terms of the clinical findings, fundoscopy shows extensive hemorrhages, and it mentions here in the posterior pole. They might also show you this, for example, as a picture test, in which case what they might show is classically two descriptions. So one of the descriptions that they might show you is a stormy sunset or of blood and thunder. So correct answer here is G, retinal vein thrombosis. Another description of the same thing is central retinal vein occlusion. Okay, so can you see how the answer option stayed the same, and it's just the scenario on the left hand side that changes for a set of extended matching questions. So as I mentioned, the majority of questions in the AKT are going to be single best answer and EMQ. So maybe somewhere between 80 and 90% of the questions, depending on the sitting, are going to be made up of these two formats. But remember that there are a whole host of other question formats that can feature. So algorithm questions, picture questions, multiple best answers, seminal trials, videos, short answer, rank ordering. And within our main online revision package for this, every single one of the common question formats and all of the less common question formats is featured, and we'll systematically go through different types and some of the exam technique for all of them. So I hope that's been useful. Please do join us for the last in this video series, which will be looking at common mistakes that lead people to lose marks and fail AKT, and most importantly, how you can avoid them. Thank you very much.